Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be with me for this next segment. We have the illustrious Dr. Ron Kroll, dentist. Dr. Kroll, thank you so very much for being with us.
No, thank you for having me.
Dr. Kroll, today you are going to teach me about cosmetic dentistry, and hopefully in the meantime, our audience is going to learn. Before we get on to that, we want to know about you. Tell us about yourself, where you're born, where you went to school, what your training is like.
Well, I'm a native Californian, born and raised in Santa Monica, California, and went to UC Irvine where I met my wife, and we both attended Georgetown University School of Dentistry. And after dental school, looked all over the country and decided Monterey Peninsula was the place to be. So we've been here 28 years practicing general and cosmetic dentistry on the Monterey Peninsula.
Excellent.
And we treat pretty much mostly families, children starting usually age 1.5 up to adults. We've had 100-year-old patients, and usually they have great teeth because they have long life. Good teeth means long life. So
excellent. Great. Well, Dr. Kroll, you know, when I think of, I guess, general dentistry, traditionally, I think of things like cavities, and then, of course, there's orthodontia, and there's braces, and then there's bridges and things like that. But I think perhaps a relatively new field, or perhaps it's not that new, but we're just learning about it, is cosmetic dentistry. What I would like to learn is what we mean by this phrase, cosmetic dentistry.
Well, part of being a dentist is creating smiles, and that's what we do. And you know, over maybe the past, say, 30, 40 years with fluoride and that sort of thing, there are fewer and fewer cavities, although that's starting to creep back up now with sugar in our diet and that sort of thing. But in the meantime, dentists have, the science of cosmetic dentistry is becoming more and more advanced all the time. The materials and the actual understanding of facial aesthetics and how it relates to all the structures of the face and the muscles, of mastication, the ones that open and close our mouth, and you know, how we use our oral cavity not just for eating but for functioning, smiling, and it's the studies have shown that it's the first place that people look at you when they look at you is your smile. And so, as a plastic surgeon, I know you're dealing with facial aesthetics all the time, and so the smile is one of the most important parts of the face.
That is true, and it's more complicated, I think, than people first assume. You know, the smile and dentition, it's important for your oral pharyngeal health, etc. So, if you don't mind, I'd like to ask you a few simple questions or direct questions, and then you can teach me, and we'll learn. The audience and I will learn together. Let's start with a common thing. Say someone feels that their teeth are discolored, and then we're going to talk about crooked teeth and misaligned teeth or missing teeth. But let's start with something simple. Let's say that someone feels that their teeth are discolored. Is that something that you see in the office? Pretty much every day.
I had that actually happen today. A woman came in and she saw a picture of this model that I have on the wall, and she said, I want to look like that. Well, you know, there are several ways to, if that's all they want is just lightening their teeth, then very often we can do it with just by merely whitening them with a bleaching solution. And we do is we have the patient come in and we make custom trays where we carefully cut the plastic tray around their gums so we don't bleach their gums. And we show them how to use it. And they wear this little tray for about a half an hour a day. And that they usually just do it till they like it. Maybe takes a week or 2 weeks to bleach their teeth.
So within a week or two, someone can, in general, lighten their teeth so that it's more acceptable to them.
Right. Usually what I do is I'll actually look what their shade is when they start, and I have a little shade tab that tells me where they start, and then when they come back, then we look at it again. And usually they can lighten it about 1 or 2 shades over that period of time, and then After about 2 weeks after that, it goes back a little bit, because when you whiten teeth, it actually dehydrates them. So it makes them look a little whiter. But after about 2 weeks, they rehydrate and they get darker again. So I usually have them do it for a few more days, and then maybe once a year if they save their trays and they're going to a wedding or a high school reunion or something, then I have them do it, again. But they're never, I always tell them, I want to make sure that their expectations are the same as mine, because very often, they think they're going to have an appliance store across the front, refrigerators lined up. But basically what the lightening does is brighten everything up. If they really want white teeth, then there's other things that we can do.
Okay, so people want to know if it works, and it sounds like it works, and then also people want to know if it's safe. I mean, is it safe to lighten and whiten and bleach teeth?
Yeah, I've never actually had a problem. I'm careful. I mean, if somebody already has fillings in their front teeth, then those will not whiten. If their teeth are a little bit sensitive to start with, I usually won't recommend it, because it could make them more sensitive. And I usually also don't do it on, I had a high school girl that wanted me to do it, and I told her wait till she's in her 20s, because the nerve inside the tooth will recede a little bit. I was a little afraid that the bleach could, on a young person, could actually kill the tooth. So, but as an adult, it's perfectly safe, I think.
Okay. Well, Dr. Kroll, what about the kind of over-the-counter treatments? Like, there's certain toothpastes and certain strips you can get. Do patients ever tell you that they use those? Do those things work?
Yeah, all the time. I'm not wild about the white strips, because they actually go up onto your gums, and I'm not sure why you'd want to put bleach on your gums. But and they're not as powerful as the bleach that we have. We have several strengths of bleach and the most powerful one you just wear a half an hour a day.
Okay. Now, Dr. Kroll, you did mention something about fillings. I guess traditionally fillings are sort of silver colored or gray colored. Now, do you ever see people who are concerned with the actual appearance of fillings, or is that something that they just must live with? Is there any way to affect the color of fillings?
Right. I actually haven't done a silver filling in about 20 years. We now use composite resin material that's gone through about 8 generations of upgrades. But usually I won't recommend that somebody takes out their silver fillings. If they want to have them out to make them look nicer, then I'll do it. But some people were concerned about the mercury and silver fillings, and I don't. It's never been proven that that's actually been a problem. But the difference is a silver filling just sits in the tooth and occupies space. It doesn't actually become part of the tooth. And so after about 10 years, they tend, because they're metal, they expand and contract and can cause small cracks in your teeth. And very often we'll see a patient come in, the filling's still there, but half their tooth has fallen off, because this filling has expanded and contracted and actually caused cracks, and then it leaks and bacteria gets underneath there. The new resin fillings, we actually bond to the tooth, and that seals the tooth off so nothing can get under there.
Amazing. Okay, so Dr. Kroll, so we've talked a little bit about whitening, lightening. We've talked a little bit about fillings, color of their. Now, let's say someone comes in and they have, for lack of a better word, crooked teeth. Or
right.
they would like their teeth to be better lined up. Do you see that in the office?
Yeah, pretty much every day. I had a young girl that just before I got here. Yeah, it depends on how their upper and lower jaw come together, and if it's just simple crowding in the front, very often there's something called invisible braces or Invisalign. They often advertise on TV, and they're clear plastic trays that are, models are taken, a patient's mouth, and then clear plastic trays are developed by a computer, and you may have 10 or 20 of these, we call them aligners, and the patient would wear each aligner for about 2 weeks. They take them out to eat, and each aligner moves the teeth about 1/4 of a millimeter, and the computer designs the final occlusion, the final bite, And each one moves. So when you first put them in, they're a little tight. And then after 2 weeks, the teeth have moved, and then you go on to the next one.
Okay, so what about veneers? These are things that I hear about, of course, and I want to learn about these things, and as I said, I'd like our audience to learn too. So what do we mean by a veneer?
So a veneer there's a couple of ways to do veneers. It can be done with that same material that I use for fillings, and that's just I just do that right in the office. That's called a resin bonded veneer. But there's also, most veneers are made of porcelain. They're custom made at a laboratory. And nowadays we try to do what's called no prep veneers, where I don't have to give an injection and I can just take an impression, and we make contact lens thin porcelain coverings. They cover over the whole front, sometimes wrap around the back of the tooth, and they're so thin that they don't make the teeth look any fatter. But the advantage to the no prep veneer is, number one, I don't have to drill on the teeth at all, virtually at all. And the other thing is the bond to the enamel. We used to make veneers where we would cut away the thickness of the veneer, and we'd get down to the underlying part of the tooth called the dentin, and that bond wasn't very good, so sometimes those veneers would pop off. But nowadays with these no prep veneers, they actually bond to the enamel of your teeth, and that bond is very, very strong, will never come off. And so they're very nice. It's easy for the patient, and it'd be good for someone, say, who has a lot of spaces in between their teeth. They have sort of narrow teeth. That's a good indication for someone like that, for something like that. If they want to lengthen their teeth, or if they want to just change their color, because that you could put, instead of, if you wanted them really, really white, you could do that with no prep veneers.
Okay, now what about, I guess going one step further, what if people are missing teeth, especially up front? That can be distracting, and probably it doesn't work as well as if a person has a full set of teeth. It's not just cosmetic, correct?
Right. So nowadays, conventionally, you've heard about bridges and crowns and that sort of thing. A bridge is 3 teeth hooked together. It's something like this, where we have to cut the 2 teeth down on either side.
So maybe we can hold that up a little higher. Let me see. Could you hold that up just a little higher, Dr. Kroll?
And this is a bridge. These are 3 crowns hooked together, and this can be done in the front as well. This is conventionally what we did, but the problem with a bridge is you can no longer floss here or here because these are tied together. So dental implants were developed. So if you're missing just 1 tooth, instead of dealing with 3 teeth, you're just dealing with 1 tooth like this. This is, I don't know if you can see this, but this is 1 dental implant.
If we hold it up a little higher.
And I can show you on this, maybe. This might be better. I don't know.
Okay, if we just hold it up a little higher, maybe we can get that.
So this is a dental implant. An implant replaces the root of a tooth. It's a titanium cylinder that replaces, when a tooth's extracted, you lose the tooth plus the root, and so the titanium cylinder is placed surgically by an oral surgeon usually, and it then heals for about 3 months. The bone would grow into the implant, and when the surgeon says that implant is tight, then they're sent back to my office, and then I make 1 tooth that goes on top of that implant, and that replaces that missing tooth. But one of the main reasons implants were developed is because when you do lose a tooth, you not only have a space there, but you also start to lose some of the bone. Your bone is no longer stimulated by the root.
I see.
And so when you lose bone, then you lose it kind of this way and this way, and also this way. So if it's gone for a long enough period of time, there's not even enough bone to actually place a dental implant, and then there are things that we can do, bone grafts and things like that. So usually we can always place it one way or the other, but it's better to do it as soon as possible after a tooth is extracted, I would say.
Okay, so what about children or adults with, say, where the dentition is sort of misaligned? You know, I don't know if people still use that term, high school kids use that term buck teeth anymore, or,
Right.
or we have different types of occlusion. So when do you help a person choose between braces, or I guess that's orthodontia, or Invisalign, or other things that you can do, or say refer for actual surgery where we can move the jaw or the maxilla forward or backward, et cetera. So how do you help a person decide if they get Invisalign or braces, orthodontia, or have oral maxillofacial surgery? How do you decide that?
Well, when a patient comes to our office, we usually do a very thorough examination, and part of the exam is to check their occlusion or their bite. And it would depend. Sometimes if they do have a discrepancy in their jaw, then in other words, between the relationship between their maxilla and their mandible, then it's actually not a dental problem, it becomes a skeletal problem, and then they would need actual what they call orthognathic surgery, and that's also done by an oral surgeon. Usually they would be fitted with braces for about a year, then surgery would be done, and then they would be fitted back with braces again. If it's just crowded teeth, or if they're severely crowded, usually it requires conventional orthodontics. And then if it's minor tooth movement where they just want to correct a little bit of crowding or some spaces or that sort of thing, Invisalign would be good for that. Or if it's just spaces or also minor things, sometimes we can correct that with cosmetic bonding or veneers, and then it's sort of like instant braces because it can be done very quickly within a couple of weeks. So it just depends. We have to look at how the lower and upper jaw relate to each other, and how we look at the entire facial aesthetics, and if they're having problems with their joint up in this area, what they call the temporomandibular joint, which I'm sure you deal with.
TMJ, of course.
And so there's all these factors that we look at, and that'd be about a 2-hour answer to that question, I think. So.
Well, Dr. Kroll, that's a perfect segue for me to have you or invite you back to come on the program.
Yeah.
I appreciate you being here. But we only have a few more seconds. Before we thank you for being here, I want to hand out give out your phone number, if that's okay. So, Dr. Ronald Kroll, DDS, you're here in Monterey, 831-649-4200.
That's correct.
831-649-4200. You have a website, drronkroll.com, right? And you can email at frontdesk@drronkroll.com. I'm going to spell that out. So drronkroll.com, drronkroll.com. Cosmetic Dentistry, Family Dentistry. Dr. Kroll, I learned a lot already. We'd have to bring you back, and we'll continue my education.
That went by fast.
It does go by fast. I appreciate you being here. Thank you so very much.
Thank you for having me.
Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health television program. We're going to take a brief pause for a good cause. We're coming right back.